Hi, this is Dr. Kenneth Walton with Northeast Georgia Plastic Surgery. A very common topic I hear will be people who have looseness to their upper arms. This happens with all of us, but particularly with people who've had wonderful weight loss. They often enjoy the decreased weight, but the looseness to the skin can become more aggravating. They worry that people will tease them about that. They don't want to wear sundresses because their arms will show something that looks more like their mother or grandmother, which can be very disappointing. There are some nice solutions for this, and really there's two categories to try to treat this. If someone has some more mild to moderate looseness to the upper arms, there's a great technique we can use where we liposuction the arms under local anesthesia and also use a heat technique that we call BodyTite. What that does is that heats the tissue immediately under the skin to do some snugging effect of that. And then we do some heated needles on the surface of the skin at the exact same time that we call a Morpheus treatment. So that combines both the liposuction with the slight snugging of the skin to create a very nice improvement to the upper arm. If someone does have more of a distinct upper arm looseness, that probably would be not enough to make someone happy, and so my advice would to steer them to be more a classic procedure of a tightening of the upper arm. We call that a brachioplasty, but doing that I can take out a large triangle of skin and fat, and I combine that with liposuction as well for some sculpting and make a very snug upper arm. And that can be very pleasing. Not only does that improve the bottom part of the arm, but it tucks the upper part of the arm, and I'll even do a little bit of liposuction at the end of the deltoid area. I call that kind of the Madonna area because it creates this almost a muscular look to the upper arm, and it's a nice subtlety to give the contours to the upper arm. But afterwards, I find patients are very confident in the clothing they wear. Again, sundresses are available for them to wear because their arms have a snug look like they did when they were in their 20s. Usually that incision fades quite nicely over the course of months or a year or so, but the shape change is often very, very pleasing for people, and it is the classic solution for people who have upper arms that they're just not very proud of. If you would ever like to talk to me about a consultation, to look at those areas or any other areas, I'd be happy to.